listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static. In today's episode, veterans give so much to serve and protect this country. Find out how you can help veteran clients utilize Medicare alongside the unique veterans benefits they qualify for. VA benefits, Tricare for life, and Medicare for veteran clients, written by Tina Lamoureux and Paige Engel. From World War II veterans to veterans who served in the war in Afghanistan, men and women all over the nation have served in active duty positions. According to findings by Pew Research, in 2023, there were over 18 million living veterans in the United States, representing about 6% of the population. Since the American Revolution, the U.S. government has committed itself to providing and supporting veterans through a variety of programs and initiatives. These programs have evolved into the most comprehensive system of assistance for veterans in the world, the Department of Veterans Affairs, or the VA for short. Part of that program includes healthcare. We'll take a look at what Veterans Affairs healthcare means to those looking into Medicare, how Tricare for life factors in, and what it all means for agents like you that welcome a veteran as a client. First, let's dive into how veteran benefits are distributed. Individuals who served on active duty in the military and were discharged or released for reasons other than dishonorable discharge can apply for VA health benefits. Eligible veterans are assigned to coverage based on a priority level of 1 through 8, 1 being the highest priority and 8 being the lowest. The VA uses these priority levels to balance the demand for VA healthcare enrollment resources. How are the 8 priority levels assessed? According to the U.S. Department of Veterans Affairs website, priority groups are based on circumstances like military service history, income level, range of disability, if they qualify for Medicaid or not, and other benefits received like a VA pension. This is not an exhaustive list of what determines the priority groups. You can find the full list, including a sublist for priority 8, in the episode notes. Understanding how VA benefits work with Medicare eligibility is important to know so you can help your client get coverage in the areas they need. However, a veteran's priority levels can change. For example, if they have income changes, or if their service-connected disability gets worse, and they are given a higher disability rating. An individual's priority level determines the priority of access to facilities and benefits, as well as copay amounts for things like inpatient hospital stays and medication. For this reason, beneficiaries that are on low priority might not be getting the optimal options for care through the VA alone. And that is where Medicare comes in. Original Medicare consists of Part A, which covers hospitalization, as well as Part B, which covers doctors and outpatient services. Those eligible for Medicare, people 65 and older, or who have a qualifying disability or illness, can have both VA benefits and Original Medicare if they qualify. This expands coverage options, giving them more flexibility with their healthcare and possible cost savings. This coverage allows them to see any provider accepting Medicare, so there's no waiting for a pre-authorization to use a non-VA approved facility or other provider. VA benefits may deny coverage to some veterans, even in emergency situations, if care was at a non-VA approved facility. Medicare is an easy way to prevent this disaster. When should clients enroll in Medicare? Your veteran clients should enroll when they are first eligible for Medicare benefits, which typically means when they turn 65. Down the road, if your client is older than 65 and loses VA coverage or decides to enroll in Part A and B afterwards, he or she will have to pay a late enrollment penalty that will permanently increase their Part B premium for the rest of their life. Encourage your clients to give themselves double protection and prevent any unnecessary expenditures. Now, what about Medicare Part D? VA drug coverage is considered creditable, which means it's as good as or better than Medicare's options. It also means your client doesn't need to enroll in a Part D drug plan, though there are certain circumstances where Part D would be beneficial. One is if the beneficiary lives in a non-VA nursing home and wants to receive prescriptions from the pharmacy associated with the nursing home. The beneficiary wants flexibility with filling their prescriptions and not to be restricted to the VA mail order service. Another is if the VA formulary does not include their medication. Should your client lose their VA coverage and choose to enroll in a Part D drug plan after their initial eligibility period, they will not be subject to a late enrollment penalty as long as they enroll within 63 days of losing their VA benefits. And while we're talking about creditable coverage, let's talk briefly about Tricare for Life. Tricare for Life is defined by the military as Medicare wraparound coverage for those who are Tricare eligible and have Medicare Part A and B, regardless of age or residence. It is separate from VA benefits. Tricare for Life also does not extend to the beneficiary's family members. And if you're wondering what wraparound coverage is, Tricare for Life is not insurance. It's a benefit program that pays medical expenses, similar to VA benefits, but different. Similar to Medicare Advantage regional plan networks, Tricare is also managed regionally. While receiving Tricare benefits, beneficiaries must pay their Medicare Part B premiums. That is the one that must be paid, otherwise enrollees will incur penalties and consequences if they stop. As far as Medicare Part D, just like VA drug coverage, Tricare for Life is also considered creditable drug coverage. If your client is enrolled in Tricare for Life, they may not need to enroll in Part D coverage depending on their situation and preferences. When it comes to VA benefits, Tricare, and Medicare, a beneficiary can have 1, 2, or all 3 coverages, but there are rules as to who pays when, where, and how much. Couple of things to remember here. As we mentioned earlier, VA benefits are used at VA facilities, while non-VA benefits are typically used at non-VA facilities. VA facilities do not serve all Tricare for Life beneficiaries. Patients must qualify for VA benefits in order to be seen at a VA facility. VA facilities are not Medicare certified providers. And finally, regardless of what your client pairs with Tricare, Tricare for Life is always the last payer behind other forms of coverage. Talk to veterans about the benefits of Medicare. The Department of Veterans Affairs strongly encourages senior veterans to enroll in Medicare as soon as they become eligible. By enrolling on time, your clients can avoid a lifelong Part B penalty, and they can have a secondary source of health coverage in addition to their VA benefits. With these kinds of coverage, the nation they once protected can offer them a strategic network of doctors, facilities, and professionals ready to offer great care. As an agent, you can help veterans rest easy. Show them the way to amplify their coverage and get the care they deserve. Now, we unpacked a lot of information in this episode. Don't forget to visit the episode notes to learn more, especially all the different scenarios for how veterans' coverage can be stacked and leveraged. Make sure you're the agent
who can help clearly explain those benefits and help your clients get signed up. Special thanks to Derek Pershing for help with the research for this episode. We couldn't have published it without you. So shout out to Derek and thanks again. It is a team effort here at the Agent Survival Guide podcast. Thank you so much for listening, and thank you to the brave men and women who serve our country so fearlessly. And with that, we will see you next episode. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written by Paige Engel and Tina Lamoureux. Recording and production by me, Sarah Ruppel. Podcast design by Urban Rivera. Artwork by Vivian Zhao. Follow along with our show wherever you like to listen. Rate and review our show on Apple or Spotify.